physical exercise is one way we've learned that you can use to change the brain in a positive way. I mean, the great breakthrough in the past few decades in brain science is the discovery that the brain can change. The fancy word that's used is neuroplasticity. Just means the brain can change. The brain can change in destructive ways, as following trauma, where you literally burn out parts of your brain, or the brain can change in positive ways. And using physical exercise to promote that is a prime example. I mean, but there are other examples. Love, love is a great way to change your brain for the better. Well, we can't really prescribe that, but we can prescribe, although we can prescribe connection, but we can also prescribe physical exercise. And then there are these targeted forms of physical exercise. In the case of learning breakthrough, cerebellar stimulation, that can have more targeted results in terms of changing the brain. And we've seen that certainly with selected patients, you can get improvement in reading, improvement in focus, improvement in concentration, and of course improvement in coordination. So the benefits are tremendous. Does it always work? No. Compliance is an issue, yes. But have I seen enough positive results to be real enthusiastic about it? Absolutely. I think this is a tremendously promising complementary treatment to go with sort of the standard treatment we already know about. It takes advantage of neuroplasticity. It takes advantage of what we've learned in the past several years about how to change the brain for the better. And the beauty of it is there are no side effects. It's entirely safe, and when it works, it's pretty dramatic. I'm a child and adult psychiatrist. I went to college at Harvard and then medical school at Tulane. I did my psychiatric training at Harvard and child fellowship there, and I was on the Harvard Medical School faculty for 20 years until I retired to give my full time to my kids, which is my most important credential, my 3 children. I've written 18 books that have sold about 2 million copies. I've been on Oprah a number of times, The Today Show a number of times, Good Morning America, 2020, 60 Minutes, Dateline, you name it, I've been on it. But it's part of my mission is trying to bring this kind of information to as wide an audience as possible, and I enjoy doing it. I've learned a lot about learning over the years, and certainly about ADD. Yeah, I mean, the problem with research these days is funding, and the people who can pay for research, these studies are very expensive, tend to be the pharmaceutical companies. And that's great. I'm glad they have the money to invest in the research that is so needed. But programs like Learning Breakthrough don't have that kind of funding, and so they rely on anecdotal evidence. And that's not the scientific standard, but it's enough to say, well, there's something here worth looking into. And if you're someone who's getting a suboptimal response from standard treatment, then look into it, as I did with my son, and got tremendous results. Until we have more funding to do the ideal gold standard study, we won't be able to say for sure this is how often it works. But I can certainly say for sure I've seen it work, and I can say for sure that it does no harm, and that it's completely safe. And so I think if you're someone who's looking for a complementary adjunctive alternative treatment, I'd recommend Learning Breakthrough as one of several possibilities. Now, medication has its limitations and doesn't always work. Some people don't want to use it. It can have side effects, so on and so forth. So then we have these alternative or complementary treatments. And Learning Breakthrough is one of several that I've become familiar with that is very promising, that I've seen excellent results with. So I would say to other doctors, we don't have the double-blind prospective study, but we do have anecdotal evidence for your patients who are getting a suboptimal result from standard interventions that it's worth trying. There's certainly no harm associated with it, and for certain patients, there's tremendous benefit. I think the alternative treatments in general are a tremendous breakthrough. I mean, the biggest breakthrough in treating ADD was probably getting it out of a moral framework into a medical framework. And then in terms of medical intervention, stimulant medication in 1937 was a huge deal. And now with physical exercise-based treatment as well as other alternative treatments, we're starting to see a whole second wave of breakthroughs, which are tremendously exciting and important. I'm always looking for interventions to help people of all ages that work. And I think I've seen enough evidence of learning breakthrough to know that it's one of those interventions that can work. If they do the exercises regularly, they tend to get benefit. So I'm behind it because, for the most obvious reason in the world, because I think it works. Many patients say they want to proceed without using medication. And I say that's fine. And you know, you always begin with non-medication interventions anyway. Education, lifestyle changes, structure, physical exercise, diet, sleep. Those are all important parts of every treatment plan. And then if they want something more specialized that does not involve medication, learning breakthrough is on the menu that I offer them. And you know, these complementary treatments don't have the research backing, but they certainly have tremendous merit. And that's how I explain it to them. I say, you know, this is certainly not going to do you any harm, and it might do you a lot of good. And I give them several alternatives that they can pick from. I think it's tremendous that we're now living in an era where people are thinking outside the box, where they're trying to find out whatever works. We don't have the kind of funding that we need to research every possible intervention. But there are technologies like learning breakthrough that have been around for decades that have helped a number of people, and they just don't have the press to gain wider application. So I'm hoping people listening to this will consider learning breakthrough as well as other complementary alternative treatments that we have available as possible interventions to get the most out of a given child or adult's brain. I mean, that's really what it's about. How do you get the most out of what you've got? And physical exercise, particularly targeted exercise like that developed by Learning Breakthrough, is a wonderful example of something that we're now learning to take advantage of, that's been around, in fact, for a long time, just hasn't been tested or publicized the way it needs to be for people to give it the chance it deserves. Because I'm here to tell you, it can help a lot more people than are using it now.